One thing that nurses sometimes do that I think could sometimes change. I'm getting a side eye here. Hey guys, welcome back to the channel. My name is Kiran. I'm a junior doctor and a comedian working in Manchester. Today, we are extremely grateful to be joined by the face of the NHS. I am of course talking about Nurse Zara. You may have seen Nurse Zara in a previous video that we did and in a vlog that we did on her channel. Today we're gonna have a really honest conversation about things that nurses want to ask doctors and things that doctors want to ask nurses. How do you feel about the introduction?
I don't mind it. I feel like it's natural. Shall we do one just without it?
Shall we do one without it?
Just so we got two, yeah.
No, we shan't. It's my channel, so
Damn it.
so my rules.
I was like I was trying to put that in there.
How do you feel about doctors, especially new doctors, when they are a bit arrogant and they think they know more than you?
It's not to say that it's the norm, and I don't believe that in any way, but there have been some situations where I have felt like it's very much like I am a doctor and I need to make the final decision. Nurses and doctors, we work as a team. You can't work without a doctor and a doctor can't work without a nurse, but a doctor does have a final say. But as a nurse, you can obviously advocate for your patient, and if you're not comfortable to do something, then, you know, not do it. Maybe once the task has completed, then I probably would go and actually say something. What's the best piece of advice you received from a nurse?
One that really stuck with me is when I was on nights once. One of the nurses who I was really good friends with basically said, if you are nice to people in the hospital, they'll be nice to you back. If you're really, really busy, but you're really nice to the staff on the ward, the healthcare assistants and everyone, you know the names and you say hi to them, and you don't have to make much of an effort really to speak to people, and people are nice to you. So I remember being on a really busy shift once, and someone who I'd spoken to a few times saw I was really busy and without even asking, like, made me a drink. And it's just small things like that. And I think the reason I bring it up is because there is this toxic attitude that we've mentioned in another video, which is on Zara's channel, in medicine, about hierarchy. People thinking you can't speak to people who are higher up in the hierarchy than you, and it's an old school way of medicine that's changing. There are still some doctors who are like that, who basically think these people are below me, I shouldn't be speaking to them, or they can't speak to me, and silly nonsense like that, basically, that needs to be kicked out of the hospital.
In short, that is the only solution for that. Great, that's a great piece of advice actually. Well done to that nurse who told you that. Yeah. Good on you, girl, representing.
What do you dislike that doctors do, / what do you wish that they did more?
Okay. Definitely, I would like to see doctors being more involved in things like personal care. That doesn't necessarily mean that they need to be sort of going forward and helping and that sort of thing. But in a situation where perhaps you have found a patient that you've gone to go and assess, and the nurse isn't necessarily there. Perhaps they have soiled the bed. Perhaps they have been a bit sick. You know, perhaps they're just in a state where they do need an extra hand and some help. Then rather than calling the nurse to come and take over, it would be amazing to have more doctors being like, this is what's happened, can we do it together? Can I come and help you? I'll grab such and such, you tell me what I need to do. Like, it just makes you feel good, like you're part of a team.
You're right that they should do it more. Can I say, I think the reason that people don't do it is not because necessarily they don't want to, it's often because they don't know how to, or wouldn't really know how to. And it sounds like silly that you wouldn't know how to change someone, but there's like ways to do things. If you've not done something before necessarily, then they might be a bit nervous about doing it. What you're saying is to ask, let's do this, and to do it together.
I think it's just courtesy also to work alongside the nurse who is caring, not seeing it as a defined responsibility, like this is a nurse's job, but actually seeing it as this is like our patient and let's just help them. So I would like to kind of throw the question back at you. So what is something that you wish nurses would do more?
One thing that nurses sometimes do that I think could sometimes change. I'm getting a side eye here. When you're on call, you are not just covering one ward and one hospital and a certain group of patients, but you're covering multiple wards, probably across the whole hospital sometimes, people will call you as if their problem is the most important problem. But you, when you're on call, your job is then to prioritize everything you've got and to make sure you go to the important things first, to the patients who are really, really sick first. And then these other things, if they're quick, you can try and do them, but if not, they just will have to come later. Specifically when you're on call, just having like a bit more chill and patience to be like, if this is important but not really urgent, just understanding that it will take some time. There's nothing you can do about it. Because if you've got this number of things to do, you have to do the really urgent ones first. And if more urgent ones come in, they're still going to keep bumping those bottom things. So it might seem like someone's asked you to prescribe a sleeping tablet, and let's say you're at a hospital that's got paper drug charts, and then you don't get there till 5 in the morning. It seems like you fobbed them off, didn't come for ages, and were messing around, but actually it's because there were other urgent things to do. And sometimes that annoys people. And you can tell it annoys them. And I make an effort to say, it's really busy, you know, this may take some time, just so you know. But I think sometimes people just need to have a bit of chill for less urgent things.
I think that's a fair comment. I've been in charge on a night shift. I think that was one thing that I sort of always said, like when the doctors would come round, or the on-call doctor, it's like, tell them what you need now and sort of try and get it sorted. And then when urgent things do come up, then they know, okay, I need to sort of assess if this is something that I can do. So I think that's a fair comment. Okay, fine. That's something that we need to perhaps work on. I'll give you that.
Is nursing what you thought nursing would be? And the reason I ask this is because from an outsider's point of view, it looks like you do a lot of work and you aren't compensated that much for it, in terms of, I don't think the pay is that good for the amount of work that you do.
So I agree with that to a certain extent. When I was a student nurse, I was just very much fixated on wanting to learn and to develop and get to that qualified nurse point. So I wasn't even thinking about the pressures of when you're actually qualified or anything. I was just so wanting to develop. And I think when I did then become an actual registered nurse, I was kind of hit with this reality that actually I am not leaving on time from a shift, because you can't just leave a task. Realizing how there's no such thing as multitasking. There's like quadruple tasking in nursing. You really have to be on the ball. Nursing has changed quite significantly since the pandemic. We just had to step up on so many levels.
So what sort of extra things were you doing after COVID that you weren't doing before, do you think?
I think definitely taking on an increased workload. For example, working in ICU. That was a big thing that was part of a lot of doctors, a lot of nurses were redeployed.
I see. So basically that's what happened to you. You didn't sign up to work in ICU, but there were shortages and lots of patients there, so they basically said, we need you to work there.
Absolutely.
And you had to go and work there.
Yeah, so that was a big thing. Perhaps doing tasks that you would perhaps normally be going on a training course for, but you had to learn there and then. And that was still safe practice, but because we had to adapt to a very difficult situation, that became our norm. I think that can be tough, and I think that's why there's been a lot of coverage on the pay not compensating for the work that we do, or that there's a shortage now of bedside nurses, or critical care nurses such as ICU nurses have moved away from bedside nursing, going into other specialties because they're tired. Like, there's a lot that we have to do. So
on that, this is a blunt question, and I will take it out the edit if you don't want to answer it.
Okay.
Do you think nurses are paid enough? Because I don't think they're paid that much.
I don't feel that we're paid enough. I couldn't give you a number. I think that's all very much like individual, like of what we should be paid. For the hours that we work, if you're working in a ward, you're working 12 hours, days and nights. You're working on a rota, so you don't have structure with how you work. And those 12 hours are very intense. They are intense. By intense, I mean you are on your feet. I think there are other problems that need to be solved, like putting more nurses in the workforce, or having an emphasis on mental health wellbeing services, or those sort of things. I think it all is part of it. Have you ever been in a situation where you've had to have a very confrontational conversation with perhaps a nurse or a senior nurse? How did that make you feel, and how did you cope with it?
So I have. If someone's giving feedback on something, especially someone more experienced like a senior nurse, then you should listen to it. There's absolutely no question about it. They've been working in that place for longer. They understand how things work. They may have more clinical experience than you, but I think there's a way of saying things as well. Sometimes what's done, but also also the way it's done as well. I think some people must have been extremely annoyed by previous doctors and then taken it out on you and given loads of attitude to you for basically no reason at all. And like you, I don't take it. So I will then say, hold on, I've not done anything here. What's happened? Like, why have you just said that? And just leave them to basically explain what's just happened.
Yeah, I think you should, I like that though. You should always give people benefit of the doubt because, you know, working in the healthcare world, you are working in a stressful environment. You are, especially in certain areas as well. Okay, maybe they're just having a really tough shift or something's playing on the back of their mind. When you have that sort of understanding, then it will be quite nice. But then there are moments where I guess maybe we can be a bit uncalled for or it could be that kind of past attitude.
Nurses are way more hands-on with patients than doctors are. Doctors flit in and out or make a plan, and often the nurse has to action the plan. But what's something that you've had to do, like a procedure or something that's stuck with you in your mind, deep in the middle of it, and just thought, this is what nursing is about?
I probably have to be, so I worked in general surgery for quite a bit of time. In general surgery, we cared for a lot of patients who had stoma care and stoma bags. I had never worked with patients who had stomas as a student, so the first time I was exposed to that kind of care was as a registered nurse, and one of the few patients that I had looked after for the first time who had a stoma, it had in fact exploded. Like, it was obviously a lot going on, but then I realized there and then, like, I just need to prioritize and make them feel like that everything is okay, that I was sort of helping them through it. But it was when I reflected back, like, I was like, I just had to clear up quite a lot of feces right there. During that whole time I was thinking, I have not felt sick at any point, and I am not at any point sort of squeamish about this. I think that's when I realized, oh my goodness, like, this is nursing right now. What would a doctor say is a good nurse?
Number one, really good at communicating with both with the patient and also with the other healthcare professionals and the doctor as well. And that's the second thing, is picking up on when they think something might be wrong. You're on the ground all of the time seeing these people, and if someone looks different to how they normally look, then a nurse is often the person who's going to notice it. So I think a good nurse is someone who notices that this person doesn't quite look right, and even if they don't know why, and mention something about it.
Yeah.
Being in hospital is horrible. Like, it's not nice for anyone. As well as these other things, to seem very helpful and caring, almost like family to them when they're in hospital without their family.
Oh, yeah, I think that's
Thoughts, assessment?
Pass. Yeah.
Pass. If there is anything that you think we've missed, drop it in the comments or send either of us a message on social media. If you've never seen Zara's channel before, check it out. It's Nurse Zara. She is soon about to overtake me in subscribers. And we need to do something about that. So make sure you hit that red subscribe button, turn it grey, and turn on notifications if you're new to the channel. Take care, and I'll see you in the next video.
Oh my god, I'm so sorry, I completely messed that up.
No, it's good.
I did not expect you to say that.
It's
okay,
good.
did I mess it up? I
No,
feel
it's
like I
good.
messed that.
It's
Yeah,
good.
true.
It's good.
Oh, can we do that again?
No, that's it. That's
Are
the
you
outro.
sure?
One chance for the outro. That's it.
Are you sure?
Yeah, we only get one chance.
I didn't mess it up.
No, it was funny.
I didn't say bye.
Okay.
Bye.